Common values. Common goals. Common sense. The Common Sense Podcast with Semi Bird.
All right. Well, welcome everybody. Good afternoon. Thank you for joining us today. I think we're on episode 8. I've lost track. I know it's only 8, but here we are. Today I wanted to have a discussion with you about mental health, addiction, and homelessness, because I think at the end of the day, when we look at what's happening in our streets, the streets of Seattle and Spokane, all over the nation, but all over Washington state, you have to ask, what is the root cause of homelessness? What is the root cause of our citizens that are living and dying in the streets right now as I sit here and speak with you? What is the root cause? So many would say, and certainly this administration would say, well, of course, it's affordable housing. It's unaffordable housing. That is the root cause of homelessness. The reason people are living and dying in the streets right now, it's because they cannot afford to live anywhere else. And I guess I would ask you, as I look to the left for our questions, what do you think? Because right now our administration would tell you it's unaffordable housing. It's not the homeless, it's the unhoused, as some have named. And so when you bring forward a solution to a problem and you improperly diagnose the problem, well, then it stands to reason that you're going to head down the wrong path as you're trying to solve the problem. And what I would propose to you, the reason why you're seeing an increase in homelessness, why it's up at least 15% over the last year, why you can see that with your own eyes, but yet we spent over $1 billion last year, just state funding, not to mention the money we've spent before that, not to mention the money that has been spent in King County and Spokane, all this taxpayer dollars. Why is it increasing? Perhaps could it be that maybe the root cause is not simply affordable housing, but perhaps mental health or mental illness and addiction? What say you? Well, as the candidate for governor for Washington State, what I would say to you is this: mental health and addiction is the primary reason people right now are living and dying in the streets. It's a very complex issue, granted. And there are those who are struggling to make ends meet. And there are those who have lost their homes and have found themselves, you would say, unhoused. And in fact, last year to this year, it went up from 13,000 to over 14,000 citizens found themselves on the streets, living in the streets. And then approximately 25,000 citizens finding themselves without a shelter of their own, whether it's a home or an apartment, a place of their own. We have a problem in Washington State, and until we get it right, we are going to keep spending and wasting money. Our citizens are never a waste of money. But do we not owe it to them to get it right? And when we talk about compassion, and we see programs brought forward to give needles or paraphernalia or safe spaces to inject, I say that what you're doing is you're adding to the problem. You're not helping anyone. You're feeding someone's addiction. And that makes you more complicit to the problem and not fixing the problem. That is an issue for me. That is a problem for me. And so I propose that we move forward in the right direction. We fund programs that actually treat the issue, which is mental health and addiction. We acknowledge the fact that we have an affordable housing issue in Washington State. As I said in our last episode when it came to discussing the economy. Let's make building houses more affordable in Washington state versus adding policies that make it more costly to build houses in Washington state, which means that we pass that on to the consumer. Right now, we have approximately 157,000 units that are available in Washington state, but that are non-available to those living at or below the poverty line, certainly below the poverty line, because they can't afford it. And the reason they can't afford it is typically because available jobs. You see the causation here. Do you see the correlation, the factors that we're looking at here? And I'm pausing and I'm looking to the left as questions come in, and I have questions that were sent in via email as well that we'll get to here very shortly. But we have an issue, and the statistics are staggering because we've spent, again, billions on homelessness. We've spent billions on mental health and addiction, and it gets worse. So if you're spending billions of dollars on a problem, that should tell you that the solution is not working. My friends, my profession, as you know, I'm a behavioral scientist, a business consultant that specialized not only in leadership development, as the Seattle Times identified, but in performance improvement, streamlining, improving, minimizing waste, and improving performance, being specific, identifying the root causes. I'm a scientist. So I've done my research. But you can see with your own eyes when someone is injecting in their neck substances that will cause flesh to fall off their body, we can assume they're not thinking about the roof over their head, but getting their necks fixed. And when we talk about the Blake fix, when our administration said that this new law will drive those individuals struggling with addiction to get treatment, well, that's not happening. When you look at the statistics going back to 2018 to date, there's a slight variation between those who are seeking or getting substance abuse treatment. What I'm trying to say, it's pretty much flatlined. Those who were receiving substance abuse treatment years ago has not really shifted to those today who are receiving substance abuse treatment. And there's a myriad of factors that perhaps we can get into. But let's talk a little bit about mental health, the mental health crisis that we have right now in Washington state. 52% of youth, 12 to 17, were unable to get the services that they needed when it came to mental health. And additionally, approximately 410,000 adults were unable to get the mental health treatment that they needed. We are shorthanded, and we don't have the mental health infrastructure in Washington state that we need. We have a problem. And in fact, we know that at our highest recently, we were understaffed in our state mental health hospitals by 40%. 40%. What does that mean? That means that we have to shut down wards. We have to shut down our services to those who need those services because we don't have the staff to fill those positions. So while we would say, well, we need to get them help and we have to spend more money and we need more money, well, perhaps we should start looking at that infrastructure. Now, in all fairness, and again, I can come up here and I can point fingers and I can shift blame and I can say, well, you know, Governor Inslee this and Bob Ferguson that. I'm not here to do that. I say it over and over again. I'm not part of the blame game, right? There's no value in that. That's a victim behavior. And to be honest, to be sincere, if you look at the governor's budget, if you look at what is being proposed, the governor and the administration, you know, we are aligned on a lot of things in terms of what is being proposed. My concern is the track record and my trust factor. And in fact, with the amount of money that has been paid and the performance from this administration, would you invest? I wouldn't. And I wouldn't if I were you either. And so while they may have the right idea, how they've gone about it is broke. So back to mental illness. We've talked about this, and I've wrote Solutions with Actions, because that's what you need to hear from me as your candidate for Washington State Governor. Send me, what do you propose? What are you going to do different? Why would we want to invest in you and hire you for the position? Well, certainly this. I'm going to reinvest in our infrastructure for mental health and addiction, but it's how we go about it. For example, just this year, our administration purchased in Tukwila a failing mental health institution. I believe it was it was named Cascadia. Actually, I think I have my notes here. It was Cascadia, right? Health Services. Yeah. Cascadia Health Services, mental health, behavioral health. And they renamed it Olympic Behavioral Health. Nice name. For approximately $30 million. Has an assessed value of approximately $19 million. And we're going to invest a lot more money into this facility. And when it was owned by Acadia, which built the drug treatment facility in Linwood, one that I stood against because it was right next to a Boys and Girls Club, but different discussion. When it was purchased by Acadia, they had approximately 137 bed capacity, then others said 100, and then now with our new budget, it says that by the end of 2024, they're going to have a capacity of approximately 72. So I'm going to get more stats on that. But what we do know, between Eastern State Hospital and Western State Hospital, prior to Olympic Behavioral Hospital, we had two primary state hospitals for civil, and now the new term is forensic institutionalization of our citizens, those who were either administered into these institutions, or those who were criminally institutionalized. So we have two statutes that facilitate that. And between the two of them, it was just over 1,200 beds. And now with Olympic, we can now say approximately, we'll just say 1,350 to be generous, because they're doing more work on Western State Hospital. And by the way, with Western State Hospital, we do know that we sunk in hundreds of millions of dollars in that hospital, and it still failed to meet federal standards, and we lost our federal certification, and we lost $53 million of federal funding for that hospital. So do you see when I say I'm just not trusting in how this administration and the replacement administration and how they handled our money and how they probably will handle our money again? We must do it better. We had another one, Pioneer North in Cedro-Woolley. Again, I think it was approximately 140 beds. And they shut down. And this was an innovative mental health institution. What was innovative about them was that they had the capacity to treat mental health and addiction. Mental health and addiction. That shouldn't be something that is, so innovative. That should be common sense to have that kind of capacity. This is something we should be looking for. So again, we have to invest in our mental health infrastructure. We have a shortage of beds. Even if now we wanted to bring everyone off the streets, even if somehow a miracle overnight, people said, I want to get clean from my addiction, we don't have the infrastructure to support them from an addiction standpoint. Or those who are struggling with mental health, we don't have the infrastructure to support them. And by the way, from a behavioral aspect, you must understand that there's an overlap between mental health and addiction. There's a causality there that we must consider. So often, therapists are treating both at the same time. So here is another solution. We just recently passed last year a compact on nursing. a law, which is one of the best I've seen in a while, to bring about a reciprocity of licensure, which says that a nurse coming from a different state can come here and have a simple pathway to be able to practice from San Francisco to Seattle, right? From Oakland to Okanagan, a simple pathway, because we are very short nurses. And as a result, we were able to plus up at least 1,300 nurses in Washington State because we are short medical staff in Washington State. And there's a reason for it. Again, this is not a blame, but please think back to when we shut down our state in response to COVID. Not all states responded to COVID the way our administration did. I don't agree with how our administration reacted to it. Other candidates do agree on both sides. I do not at all. I didn't agree with shutting down our businesses. I didn't agree with shutting down our places of worship. I didn't agree with mandatory masking. I didn't agree with mandatory vaccinations of our mental, or I would just say our health professionals, and that included our mental health professionals too, if you're working in a facility, or our state or civil employees. People lost their jobs, their livelihoods. And what does that lead to? Oh, perhaps maybe drinking or drugs or addiction or anxiety, then depression. Do you see where this goes to? And what could be a causation of homelessness? Have you ever heard of people losing everything once they succumb to addiction and then they find themselves out in the streets? Consider it. No blame. What I'm saying is, I would not have done that. You deserve to know that, because from a national standpoint, this could come back around again. Not predicting it. I'm just saying it can come back around again. And as your candidate, you need to understand how I would react, not that. And if you ask me my opinion and how this administration reacted to it, my answer respectfully to the office, terribly. And that's with respect to the office. And so, back to point. Within 1 year after the shutdowns, approximately 46% of adults in Washington State reported behavioral issues, anxiety. That is a statistical fact. So we look at causation. We look at where we're at. We look at the situation that we're facing. We look at what is being proposed by the new administration. Billions more dollars to be spent. I was giving you a solution, talking about a great law where we were plussing up our nurses, and that is working. Why would we not plus up our mental health professionals, our addiction treatment professionals? And we do that by another compact. So we've already proven success with that law. Let's bring that back and let's open it up for mental health professionals, addiction treatment professionals, because building the buildings, bringing the infrastructure forward must also include those human capital assets that we need to run it and to work it and to provide those services. So there is a solution right there that must be considered. Recruiting and retention of personnel. When I mentioned that Pioneer North Center and Cedar-Woolley that closed down, the reason they closed down, the causation of that was in response to the shutdowns and the requirements therein. They lost personnel, so much so it created a hardship for the organization. And then later, just this year, I believe in January, they shut down. So causation, right? Keep that in mind. I'm going to take a pause. And I want to go to some of the questions that we have here. And then I'm going to get back on track. So I've got questions here, and I'll be looking to the questions to the left. And so here's one. What authority can you leverage that will protect us from the insane city policies that only encourage homelessness and crime? So one of the things that I've written in terms of my solution to homelessness, and I'm going to go right there based on this one question, and then we're going to finish, and again, we'll answer some from the screen as well, was that we would look at a declaration, an emergency declaration, nothing like what was done in the response to COVID, where we infringed upon citizens' rights and violated their constitutional rights and had to require or ask for legislators to sign away our rights. And, no, we're not doing that. This is 43.06, that 10 of the Revised Code of Washington, subsection 12, specifically where it defines what the roles and rights are of governor, what you can do in a case of, health issues, right? Lawlessness, that's crime, right? Health, and issues such as homelessness. And it doesn't say homelessness, but it talks about civil instability. Well, then that fits right into that. And so by declaring such, that means that I, that would fit that question. That would give me the authority so that if a city says, no, we want to allow them to pitch tents and poop on sidewalks in front of my business, and I'm happy with that. And without me digressing, because I do that a lot, how many businesses have we lost in Seattle or Washington State because of crime and homelessness? Specifically, really with this question, crime and homelessness. So those cities who have failed to take action, in fact, that have resulted in a loss of law enforcement personnel. In fact, as I said in one of my segments recently, Washington State ranks last in the nation for law enforcement staffing, meaning we have the lowest amount of law enforcement officers in the nation per 1,000 citizens, right? I think it's 1.12 law enforcement officers. It's ridiculous. We're last. And we have lawlessness and a homelessness problem. And so declaring that state of emergency and then activating the Washington State National Guard, not to go out in the streets, but to clear 10 acres of land outside state land, clear 10 acres and set up a facility. And my friends, the National Guard engineers, these are the best of the best. These are engineers that can set that up. We have heavy equipment operators. We have vertical. We have lateral. These folks are good. We set up that facility, that infrastructure. We have mental health professionals. We have addiction treatment professionals. We have health professionals, doctors, right? Nurses. We have the best of the best in our citizen soldiers and airmen and women. And every month they drill. Once a month, 2 weeks in the summertime. And we have a budget for this. And under Article 3, Section 8 of the Washington State Constitution, I am the Commander-in-Chief of the National Guard. So we set up this facility. This is an inpatient program where we get our citizens off the street, out of the cold. We have some of the best nutritionists, dining facility professionals, bringing nutritious meals, safe, secure for their protection, right? We bring these facilities. That is compassion in my book. And then we start to bring drug treatment, mental health services, and we get them clean. We get them clean, and then we bring in certification programs, trade programs, get them certified, get them a trade. As Dr. King used to say, again, jobs are freedom. Right now, small businesses, large businesses, our businesses in Washington State are crying out for certified personnel, for individuals with trades to fill positions that they can't get people to fill. Why would we not? And so we give these people back their lives. We reintegrate them with their families, many of them parents themselves. We're giving them back their lives. Is that not compassion? And then when they graduate from the program and they go to transitional housing, and along with it, they have their counselor that they'll be assigned to, because this is a lifelong journey. But knowing that opioid addiction has some of the highest recidivism rates, we reduce the recidivism rate by eliminating the triggers because they now have a high-paying job on that Monday. They have their family back. They have a light at the end of the tunnel. They have a future. They have their lives back. And for us taxpayers, besides doing the right thing by lifting someone up out of despair, they are now producers, taxpayers, and they are given into the system to clear the way to give their lives back to others who would follow in their footsteps. And as the program continues to have success, we grow the program. This is my idea. I published it. I put it on my website. I'd love to see your questions. I'd love to hear your thoughts. I'm always willing to listen. And I know people said, well, Semi, why don't we just use Whidbey Island, the prison? Put them in prison. My friends, while I appreciate, perhaps you're thinking fiscally, that's me. No, we're not going to set up for the filming of Escape from Washington. Little pun. No. Not only are those terrible and miserable optics to say, because you know what's going to happen. You know, Governor Bird throws homeless citizens in. No, we're not doing that. Where do you think our high sex offender? You get where I'm going with this. No, we're going to give them all the respect they deserve because they're our brothers, our sisters. And many of you know I lost my nephew to addiction, fentanyl overdose last year. And again, I'm not being biased. I'm just saying I'm vested in this, not just because it's the right thing to do, but I felt it. And many of you out there have felt the sting of addiction, not necessarily for me or for you personally, but a member of our families. And so outside of what is common sense the right thing to do, we know it's the right thing to do. And so that is my thought. That is my proposed solution. And at the same time, we must have programs for those who are struggling. And I've said this with my economy podcasts, and I'm going to publish a document on economy as well, specific to building in the building industry and establishing partnerships to make building more affordable so that passes on, and then to make partnerships to contract for affordable housing. So when we're talking about that 157,000 available units, to make them more affordable. But here's the key, my friends. How about this as a notion to lift people out of poverty and despair, jobs, training, get them the skill sets, the certifications, so that they are making more money instead of, again, lowering the standard, meaning keeping them poor and then bringing in housing that keeps them poor and poor housing. Let's lift them up. We can do both, but lift them up. That is my proposal. I'd love to hear your feedback. And I see questions coming in. One person said, this is from Ronnie, why can't, I think we said we use Western State Hospital for this? And yes, Ronnie, so great question. I'll use your first name, Ronnie, because I'm not sure if you want your last name out there. Ronnie says, why can't we use Western State Hospital for this? And Ronnie, I love this type of thought. Let's repurpose. Let's save money. Fiscal conservative here. Here's why. We don't have the room. We do not have the room. It's brilliant. Between Western State and Eastern State, we only had, I think it was like 1,217 beds, right? And then now with Olympic Behavioral Hospital, the new addition just from this year in Tukwila, even if that raised at 100, the budget from this new budget, biennial budget, says 72 by the end of 24. But even if we raised it 100, we still don't have the room. Right now, Western State and Eastern State Hospital, Ronnie, is so overwhelmed. Not only do we not have the room, we don't have the staff, but remember we have the civil and forensic. It used to be called civil and criminal. The civil institutionalized citizens are now being transferred out and put in smaller rural and or nursing homes because, well, that's this administration's shift to make more room for forensic, more relating to criminal institutionalization. Ronnie, I appreciate that, and I appreciate your question. I'm going to go from there to here. I'm going to look for a question mark to make sure I don't miss any questions. The next question here. Will you require workable people to actually work? So, to get benefits. And I think what this person was asking, if you're on state aid or receiving state benefits, will the state require you to work? Here's a thought on this. To get unemployment, you can only be on unemployment for a period of time. And you must show that you're going out and you're seeking employment. I believe that's how it works. Why would you do any different for state aid? The reason I hesitate and I pause, and I won't just say, well, yes. Well, because it depends on the situation and the circumstance. We have different situations and different people who, again, but you did say workable, people who can work. It depends on the situation if they can, and that's not just physically, right? Single moms, I'm going to say it. My mom, 7 kids, she did find a way. We were in Washington State, Department of Social and Health Services. And I have to share this wonderful success story because you know my story. I don't think I've shared this with you guys. We started out on welfare in Washington State, food stamps, welfare. And my mother ended up working and retiring for the Washington State Department of Social and Health Services as a caseworker. So my mother, not only did she model the role of an amazing parent who sacrificed her life for us, meaning she gave everything for her kids, but she also gave back to the state who facilitated opportunity for us. Mom used a state program, to your point on this question, to get training so that she can get a job and get off of welfare. So that is what I want to build upon, programs just like that. So let me just finish that question by saying this. State aid, welfare is not intended to be a retirement system. We have to stop paying people enough money to keep them poor for the rest of their life, and we as a state government should not facilitate generational poverty. We need to lift people up out of poverty and despair. We need to finish Reverend Dr. Martin Luther King's dream and start lifting one another up, right? And again, no greater freedom than a good paying job. So instead of giving up hundreds of millions and billions of dollars, let's start teaching people how to fish. Let's start giving them that freedom. Certification trade programs. I'll say that over and over again and over again. So I'm going to look to the left. I'm just going to get my mouse going. You guys bear with me just to see if there's any more questions. Figure out a way to streamline the permit process. So we're talking about, and this is Peter. Peter, thank you very much. From a construction standpoint, and I believe Peter's alluding to affordable housing. So our permitting process, and this is typically at the county level and or at the city level, depending on your jurisdiction, that I know to be true, experience in this. And so the permitting process can be long and drawn out, which costs builders money as they're waiting, and then costly in and of itself, because depending on the municipality, I mean, it could be thousands and thousands of dollars for a permit. And as I said in my last, I believe, podcast, I did mention that they now changed, because of climate change, accessibility to natural gas, trying to do away with natural gas, which says now it's going to cost us another $9,000 to build a house because of that. So part of this new budget, 24-25, that the governor passed, because the governor proposes the budget, legislation approves it, the governor signs it. Climate change is a priority. Climate change is a priority. And of course, when they refer to homelessness, it's housing and homelessness, housing and homelessness. And then mental health and addiction is separate. You have to understand why that is. That's going back to that broke solution. But why would we not start to facilitate the pathway to make housing more affordable? And since we're talking about that, let's bring forth those contracts. I've already stated this with developers. Let's start looking to partner with municipalities, because I'm not for state government telling counties or cities what to do. with their zoning. That's separation of powers, right? But partnering with them, tax benefits, there's things we can do to zone more residential when we have commercial land that's not being used and we're at a shortage for residential. So there's a lot of things we can do. You see the combination. Jobs, bring in those jobs, right? And let's not shut down our economy. Okay, there's my ping there as well. Because, there was a root cause there not too long ago. What, a year? How long did we keep the mandates in place? Right? What did this do to the ferry fleet? Yeah, that's why if you have to commute from the peninsula, I'm sorry, I digress, but this deserves attention. Someone brought it up the other day. If you have to commute back and forth, you realize when they put these mandates in place, we lost valuable personnel, Department of Transportation, from our ferry fleet. And that hurt us. It's not my opinion. It's a statistical fact. I'm an HR professional. Y'all know that. And then, of course, the electric ferry, which is going to cost us double, and we won't have any for several years. And so things that must be considered when you're looking to hire your next governor. And again, Peter asked about McNeil. I spoke about that. As much as I'm a fan of repurposing space, we're not going to put our citizens in prison, our homeless in there. I've created the solution, building that camp that the National Guard will do. It's cost effective. And remember, the National Guard has an annual budget. And now when those citizen soldiers, those great state patriots come to drill every month, how many of them can go and serve our fellow citizens to give them their lives back? And so we're saving money there. If you look at this new budget, which is published, which I do appreciate the administration publishing the budget, look at the hundreds of millions of dollars that are proposed. Look at the billions of dollars through a bonding initiative over the next 6 years that's being proposed by this administration. My friends, more than you want to look at, but it's not encouraging. It's, for me, as a performance improvement and as a business consultant, it's very depressing because I see the forest for the trees. Not good for us as Washington State. And are you tired of being taxed to death? I'm just putting that out there. Some people may be wealthy enough that they just don't care anymore. I do. What can we do about people who want to be homeless? So another way of putting that is, I don't think anybody wants to be homeless, respectful to the person who asked us, but I think I can look a little bit deeper into maybe what you mean by this. I don't think anybody wants to be homeless, but there are people who will refuse treatment. There are people who will refuse this program. And I'm glad this question is there because that was the gap in how I answered or how I brought forward that solution. The gap was that question. Well, what if a person says no? They don't want that great program, Simi, that you propose. Well, here's the reality. The other side of that compassion is tough love. The key word in that phrase, tough love, the key word is love. And as someone who's been out in the streets, I'm not sure if I was in a show the other day, a wonderful show with a wonderful gentleman. I'm not going to say who because I want to wait for him to come out and put it out there. Maybe he's just done it since I've been on the air. But I may have shared a story. I was out interviewing homeless, and I walked past a homeless encampment, and it was emotional for me. And, when a grown man tears up, you don't want people looking at you. But it impacted me that much. That much. I'm tired of it. And I'm tired of the politicalization of it. I'm tired of the homelessness industrial complex that has been developed around a crisis of people suffering. I'm tired of it. So that tough love says this: we're going to give you every opportunity to get your lives back. But you're not going to be living on the sidewalks, no more tent encampments, because it's illegal. We have to enforce our laws. It's the rule of law must prevail. So no, you have a choice. You can either go to jail because you're breaking the law. And again, it's not just round people up and say, well, you're breaking the law, you go to jail. You have the right of every citizen. I mean, I think it's compassion to give a person a warning. Maybe there's a friend you can call. I'm just putting that out there. But you cannot stay on the streets. You cannot camp on a sidewalk. You cannot just stop and camp anywhere you want to or break down in and stay there. You can't anymore. It's been against the law. They just stop enforcing the law, which goes to that other question, what authority can you use? In case a municipality says, well, we don't care if they take a broken down van or nurse or whatever car and just stay there. What about the people who live there in those neighborhoods, property values? What about those business owners? What about the citizens who want to walk up and down a sidewalk without stepping into something, smelling something, or being hit up? And if we were to get very, not graphic, how do you think people make money when you're struggling to get that drug? Right? People say hustle for it, right? Do you sell yourself? Do you steal for it? There's always a victim to that as well, besides the victim victimizing. You see where I'm saying with that? So you have a choice. No more are we going to allow this to happen. I hope I answered your question to that. So we're going to call it tough love, right? Let's see here. D, it was good seeing you. Peter, thank you very much. Someone was saying repurposing the island, right? And, no, I got you. Not putting him in prison. No, and I got what you're saying, Peter. I have you. And so if the island's completely clear and, we're not housing any, sex offenders there, and we've taken, access, et cetera, I would consider repurposing if it's cost effective. Look at how much money we spend right now, and we're going to be spending for mental health infrastructure. But Peter, I'm all for it, my friend, and I promise I wasn't going to try to throw you under the bus on that one, but no, you're good on that, and I appreciate your questions. What kind of infrastructure is needed to deal with mental health in our state? We talked about it, and just to quickly add just a little bit more to it, I spoke about that Pioneer North Center when they were referred to as innovative because they had both mental health and addiction. We need that. We need more of that. We don't have nearly enough of that. And by the way, please understand this. Treatment options. A methadone clinic. Methadone is addictive. There are options. There are pharmaceutical options, non-addictive. We have to consider these things. And then where we put them, where we position them. Not next to boys and girls clubs, not next to schools. And does a person struggling with addiction, do they need an in and out, an outpatient, or do they need inpatient? Right? Keep this in mind, because often an outpatient program is a Band-Aid that does not work. You are struggling with one of the most horrendous addictions on the planet. You come in and you get a treatment, a pharmaceutical treatment. You go back out to the same group you hung out with. What do you think the likelihood is of recidivism where someone says, hit this? You get what I'm saying? Look up the statistics. It's not good. People need inpatient programs. And to that other question, what if they don't want? That's why that question was important, because studies have shown, statistics show, that there has to be a life-changing moment to get someone to separate themselves from that opioid addiction. It's very, very difficult, my friends, very difficult. Again, I'm saying that from a behavioral science standpoint, not from experience. So before the rumors start, can you hold homeless organizations accountable for enabling the problem and not fixing it? So here's what I say to that, and I'm going to keep looking over here for questions. When I was referring to the homelessness industrial complex, what I was referring to is this. There are some good programs out there. some great programs, faith-based, non-faith-based. As a matter of fact, I'm not going to say names. I'm going over next week to visit two. One is faith-based, one is not faith-based. I know both of these programs ran by two amazing people, right? An amazing pastor and an amazing young lady. I spoke with on the phone, and I know the reputation of this program. Again, I'm not going to say the program. They go out and they clean up areas in Seattle. There's another program, I'm just going to say in Federal Way. I didn't get the permission to say their names. They go out and they clean up, and they also try to help out any way they can to refer those who are struggling with addiction, who are homeless. They try to refer them to help as well. Point being, there are some good programs out there, but there are a lot of programs that are not performing at all. And we, as an administration, we have an obligation to you, the taxpayer, to bring oversight. So if we're spending billions of taxpayer dollars on programs and we're funneling that money out, let it rain, to nonprofits, and there is no accountability, there's something wrong with that. That is irresponsible, and it lacks accountability. That is the change of my administration. Remember, I said day one, I will conduct a third-party audit of all state programs and all state offices. One of the things I did as a federal employee was I ran the Acquisition Career Management Program, which provided access to the training for acquisition, procurement, and contracting professionals. I learned to become a contracting officer representative. I have an awareness of this. I've worked in it. And when I was in the military as a special forces engineer before I went into intelligence, well, that's what we do. We are also on the team. We are the team's procurement specialists. That's what we do, acquisition, procurement, and contracting. So I have experience in this. That is where we spend a lot of your money, taxpayer dollars, to acquire or procure services and then do contracts with them. This purchase of $30 million of what was known as Cascadia Behavioral Health, now Olympic Behavioral Hospital in Tukwila, assessed at $19 million. We spent $30 million. That would be something that I'm experienced doing, not only from a real estate investment standpoint, but the contracting, the procurement process, ensuring that we're getting bids, right? Now, to the question at hand, because I told you, guilty as charged, I digress. But if you have a contract for services, and that's where I was leading up to, there are certain performance mechanisms that should be written in the contract. And that COR, or that CO, that contracting officer, should be ensuring that that vendor is performing to contract specifications. This is something I'm familiar with and I know. So when you look for that next governor, when you're looking at our resumes, and I hope you are, not just this nonsense of who can win and who has more money, but actually the resume to do the job, please consider that. It's your money that we're talking about playing with. Billions of dollars of your money. And maybe at some point in time, we'll get tired of spending and paying too much taxes. I know I am. Looking to the left, you guys bear with me. And I'm looking at a glance because I don't want to spend a lot of time doing this, but you guys deserve it. I got that, Peter. Yep. So another person said that. All right. I'm not missing anything, I don't think. Okay. Guys, if you type something and I missed it, do me a favor and please retype it. I'm going to go here just to make sure I didn't miss anything. What can you do to make housing affordable? Okay. I've kind of spoken to that. So if you guys have questions to submit there, please get your questions in. And then we'll wrap. I've talked about it. To make affordable housing, to make housing affordable, again, you have to make it affordable to build the houses, right? Or to build the complexes. You have to have the commercial land to do it. You know how dense Puget Sound is. And so now I'm taking Snohomish, King, Pierce. You need to understand that. So there's complexity, but I'm not one to dance around complexity as a developer or real estate investor as someone who's built, someone who's trained in civil engineering, I understand this. Permitting process from grading through punch lists, right? I was telling a gentleman the other day. Again, resume matters, right? You have to make building affordable. You need to establish partnerships. You need to be able to partner with municipalities to incentivize them to free up land that has been, again, categorized, right, for commercial to recategorize to multifamily, right, and or residential. And in most cases, we're talking for affordable housing, typically multifamily. Housing costs have gone up 14%, and that's just in King County. And there's another number to this that I know I'm missing. I think I mentioned it in the economy last episode. But when we look at the percentage of the increase, it's significant. Essentially, unless you're making over $800,000 a year, you cannot afford a home in Puget Sound. That's terrible. What about young couples? What about impoverished couples? And keep this in mind also. Again, we will often say, should never be about race. Well, it shouldn't. Any person who has a human heart should understand that. But statistically, yeah, black and brown people have the lowest home ownership of any demographic. So why are we not? Why are those leaders not active in supporting these solutions to partner with developers to ensure that we re-section plats of land, partner with these developers where they foot the bill to come in and develop that land, knowing that they're going to have a state contract, right, long term. So now they're going to have a contract that's worth money. I know this. It's worth money. It's called a residual income, a residual contract. This is worth money. They could sell that if they wanted to. And who benefits? The people who are looking for an entry-level place, an entry-level apartment, right? And they keep that rent low, right? We don't have to pass laws to do this. They do it because it's part of the contract. They keep it low because they're guaranteed. Anybody who's ever owned rental properties, you want to keep it occupied, right? Because you know that, again, that is a residual income that you have every single month. You can bank on it, literally. Why would we not do that? Bring those contracts to bear. That is the incentive for them to come in. They build it. It's their capital investment. They own the land. They own the property. Plus, they have another investment, that contract. So it's a win-win for them. It's a win for us because now we've just brought more housing units on the market. Right now, we're under, I think we're 14% below building performance, meaning, and that's the wrong wording, we should be building more units in Washington State, but we're 14% under that. And I can promise you, it's the laws and over-regulation in Washington State that's driving that. So that's the other factor on this question. What can I do? Deregulate, incentivize, partner, contract, right? Jobs. You see the causality, and I told you guys about this before, right? That correlative effect. It's on all of the above. But you have to have someone with the knowledge, skills, and abilities to understand that, to bring those solutions forward. And so I want to take another look over here. Someone says we don't have a housing shortage. We have a wanting to work shortage problem. So TBMC, I appreciate that statement. There are some people, and this is not a snarky statement, statistically, it's been proven. There's studies that have shown mostly, and this is behavioral for many, many, many years, but also statistic as a result of the COVID and reactions to COVID, to where people were laid off and they were shut down. You remember where we paid them money to stay home? You guys remember this? Well, you paid them so much money to stay home, then now you got used to behaviorally to stay home and making that money there. It became easier to do that. Going back, there's the transition. And so I don't want to read into the statement, but there's some fact to the statement. There are some people who could work who don't work. And we have to be careful in that, because some people have made not so nice statements like that and have attributed that to certain groups of people. And that is certainly unfair and wrong, but that's not what this statement was about. There's truth there. There are some people who just refuse to work. Well, you're not going to retire in state aid with that attitude, certainly. But for those of you who want to work, let's make it happen. Let's bring jobs in manufacturing. Let's bring those jobs to Washington State. Let's take advantage of that innovation, right? Let's build affordable housing in Washington State, because we do have a need there. We really do. We really do. Someone said, what polls are you in? This is Spencer. What polls are you in? So Spencer, I don't give a lot of stock to polls, but I'll be truthful with you. And there was two that I know about. One poll was done by the Progressive Institute. They don't like me very much. I want to guess it's because I have an R behind my name. And you guys will notice this shiny new R. That was one of the PDC complaints that came in. And they say, well, I'm advertising, so you didn't have the R up there, and so we do. There's a lot. This podcast, Mr. Parker, filed a PDC complaint just yesterday, I think it was. I mean, they come in, and these are Republicans, in most of the cases filing PDC complaints against me. So much for party unity, right? That's, again, you see how it works out, right? It's not about the party. It's about people. And as we wake up, we realize it's time to stop drinking the Kool-Aid and start focusing on the issues. And we, the people, citizens, leading self-governance and getting back to reality. I digress. I got consumed with that. But the polls, the Progressive Institute said, I'm an ultra MAGA. And you have a choice between ultra MAGA, the Bob Ferguson, Senator Mark Mullet, who I think is a kind gentleman, Mr. Reichert, Dave Reichert, who I think is a kind gentleman, and I respect both of those gentlemen, and myself, and the Progressive Institute, after they put that out there, and they said the two faves are Bob and Dave, and then myself, and then Mark. That was the poll that they came up with. And then they asked a question, if you had to make a choice today between Bob and Dave, who would you choose? And so that was the poll. And then both of the candidates circulated that poll to raise money. So that was one poll. And then after that poll, there was another poll that was circulated on social media among conservative sites. And it was very similar, except I was included in this one. And they said, if you had to choose between Dave and Simi, who would you choose? And then Simi, last time I checked, was winning by 64%. And I believe Dave was at 35%. So I was at 64, Dave was at 35. And that was that poll. Those are the only two polls that I know of. And I like how Taylin, and my friend, it's good seeing you, says it's no longer Democrat versus Republican, right? She says it's now establishment politicians versus we the people. And here's what I will say to that. Respectfully, I agree. And it comes down to this, and then we're going to wrap. It's the groups of the politically connected and the very wealthy who support the politically connected. And I get it. I'm not against them. They have every right to do whatever they want to. But that's not how this country or the Constitution was founded. The Constitution, those big letters, those big words, right at the beginning, we the people. We are a constitutional republic. That means it's we the people. Power is inherent in the people. Government is instilled amongst the people. So the people vest power in the government and the rule of law, the Constitution, and the people. That is what makes up the constitutional republic. not any elite class, not any specific group. And so I hope you can understand that when you have wealthy or connected people making decisions as to who's going to be the candidate, well, for me, it's wrong. It doesn't make them bad people. Not at all. Again, it doesn't. I don't think they're against me personally. I don't. But it's up to us. It's up to you. And so I'm going to close. But here's what I will say. If you want to take back your state, if you believe people over politics, if you believe in restoring the rule of law and cleaning up our streets and bringing back that beautiful Emerald City, the city I grew up in, the city I was raised in, if you believe in change finally, right, of the people, by the people, for the people, that's who I am. There's nothing special. I'm not the Manchurian candidate, right? I'm just a guy who's been blessed, who's been fortunate, right? Who's fallen, who's gotten up. I'm no better than anybody else. I'm just a person who believes he was called to serve. This is a position of service. I am applying for a job, and you are the hiring panel. Please look at my resume. That's all I ask. But make no mistake about it. If you look at the amount of money we've raised, it may not be $1 million. But ask yourself why. It's not a reflection of me as a person. It's not a reflection of my resume, clearly. It just means that I'm a different kind of a candidate. I didn't come into this race with big money donors backing me and big name politicians backing me. I'm that David and Goliath, I guess. I'm the underdog. But if you believe in we the people, well, then I'm you. So are you ready? Are you ready? I mean, are you tired of yelling at the TV? Are you going to do something about it? I'm going to end with this. I went 2 minutes over. I've said it before and I'll say it again. I was wounded in action for my country overseas, fighting to protect and defend the Constitution of the United States. Now I'm doing the same thing right here on American soil in Washington State, the state that I was raised in. Are you willing to join me? If you are, go to Bird for Governor right now. Go to birdforgovernor.com and donate. You're not wasting your money, because here's the deal. I'm not quitting. I don't care how many people file complaints. I don't care how many people make up fake Twitter accounts saying nasty stuff, trying to make it seem like it's me or my team. No. I don't give in to dirty politics, and I will never lower myself, because that's not who I am. I don't call names. That's not who I am. But if you believe in America, you believe in saving our state, and you believe in a different way, you want change, you want real solutions with actions, and you want to give voice back to the people, and like Talon says, it's not a matter of Democrat versus Republican. It's we, the people. And the fact that we're different, the fact that we are diverse, we have different thoughts, we have different opinions, that has always been the strength of America. Regardless of race, creed, color, or religion, we are Americans. We are citizens of the beautiful state of Washington. It's about time we realize it. It's about time we unite. We come together. We save Washington State for our children and our children's children. United we stand. Together we can. Washington, let's make history together. Thank you, my friends, and I will see you next week. Take care, and have a great weekend.